It's a beautiful afternoon to you. Glad to know that you're there with us today on Flipside with yours sincerely, Oloije Oihohai. Today on Flipside, we'll be going to the health part of Flipside. Yes, and today we'll be talking on diabetes, the way forward. Now, on Sunday, will be World Diabetes Day. And so we deem it fit to talk about diabetes today, everything that has to do with diabetes, the prevention, what is diabetes, what causes diabetes. And to do that with us today is the person of Dr. Uju Barry. Good afternoon, sir.
Thank you very much. It is nice having you again.
Likewise. Okay, so first off, right now, we will want to ask Dr. Barry, what is diabetes? Now, we know we've been hearing this often and often time, year in, year out. But it will be to know that some persons actually don't know they have this ailment in them, and they don't even know it's severe. So we want to educate our people today concerning diabetes. So we would like you to educate us on what diabetes is all about.
Yes, thank you, EJ. Diabetes is a chronic illness of over 500 decades, and until insulin was discovered about 100 years ago, diabetes is simply defined as an illness that has to do with insulin deficiency, where the system is not able to regulate the sugar level in the body, and this has to do with the deficiency in insulin that is being controlled by the acetylcholesterol. Acetylcholesterol is located in the pancreas of the human system. So diabetes simply means that there is high sugar in the system, not able to be controlled by this set sense, which is the acetylcholesterol. But somebody to say that there are different types of diabetes. You have the type 1 diabetes, you have the type 2 diabetes. You also have the maturity onset diabetes. Of course, you have the gestational diabetes. That's that to do with that came up maybe due to pregnancy. So that the type 1 diabetes is commonly seen in young people, though you can also see it in adults. And while the type 2 diabetes is where you have the majority of diabetic patients, over 90% of diabetes are in this category. It can be seen mostly in people above 30 years. But diabetes can be seen in any age. But the maturity onset of diabetes is the one that probably as the patient is going from between 18 and 25 years or thereabout, then you begin to talk about high increase in sugar level. But what is most important in diabetes is that there is increase in sugar level and the insulin is not controlling the sugar, because there are some cases where you can have what we call glycosuria. A pregnant woman can be having sugar in his urine, but that's not a diabetic situation. But what is most important is that this sugar is up there and is not being controlled. And what are the normal values? When the sugar level is above, because the normal sugar level is 60 to 100 for fasting blood sugar, that the patient are not taking any food. So as soon as the sugar level is persistently above 126, recorded in 2 or 3 readings, that you say the patient is diabetic. And once there is a random blood sugar test that is done for a patient or for a client and the sugar level is above 200, consistently, then you say the patient is diabetic. In all this, there have to be features that are alongside that you begin to make diagnosis of diabetes in mellitus. Now, one of the commonest feature that you must see that may be present in patient that could be diabetic, like talking about some persons are diabetic, they don't know about it. Yes. But I tell you, in diabetics, almost always every time the patient may not be asymptomatic, but just that you don't know the symptoms or the features that you may have. That was the patient has diabetes. The patient may be having increase in urination. What that means that the rate at which the person's urinate might increase.
Okay, now now we are talking about the symptoms.
Yeah, we're talking about
the symptoms. What the person will say, the common things.
Yeah, because the way you are defining a chronic illness diabetes, it's actually a constellation of symptomatology. So it's not something that you just say, oh, this sugar level. Okay, you can talk about the sugar level, you can talk about that. Most times, if a patient begins to urinate frequently, more than usual, especially when it comes up more in the night, patients have what we call nocturia. That the patient is now having more urinary symptoms, more frequency. Because if a man is 63 years old and a man is having prostrate or the increase in prostrate size, he can also have increase in urination. If an individual has urinary tract infection, there can be increased urination. But in diabetes, patient can also be having excessive taste or polydipsia. Patient might want to be taking more fluids, more water intake than usual. Then again, some patients might have increase in appetite what we call polyphagia. But it doesn't end there. Another frightening symptom is that some individuals start losing weight. You know, weight loss, very, very common in diabetes, even with adequate appetite. Patient is eating well, but suddenly begin to lose weight. And that's why you see that we talk about diabetes as one of the common illness that you say a patient is immunosuppressed. Because when you say immunosuppression, it means that the immune system of the individual is going down. Diabetes is one of them. You have HIV, you have cancer, you have any of these viral illnesses, even malnutrition. But for diabetes, patient is having adequate appetite, and yet patient is going down in terms of weight. So in all these features put together, then when you now examine the individual, you now begin to discover some other features that is pushing toward that. Patient may not be having things like blurring of vision. Patient will not be having things like erectile dysfunction, especially for male counterparts, because there are so many complications. So the complication of it can now be coming in form of the features or the way the patient is going to present. Then you now come to run the necessary investigation that we're going to talk about later. So in all this, once you begin to notice any abnormality in your system, some of the features that we all talked about, it's always good to go to the hospital. Or you just go to the nearest hospital to you, then you run some basic tests. For instance, if you know that your urine is increasing more than you know normal, it's good for you to have index of suspicion to say, cool. And especially when apart from talking about the features, now you have to go like, what are the causes? Because diabetes causes most times may not be known, but the biggest risk factor for diabetes is that it can run in family. I've seen family where patients, about 3 brothers, 4 sisters, a mother, father. So it can actually run in family. So it has a familiar predisposition.
So it's hereditary.
Yeah, so it can be hereditary. So that's one of the risk factors. A patient that is hypertensive can also become diabetic. There's a study that was done in Enugu in 2013 by Lesanya and others, where it was said that in every 80%, in every 20% of hypertensive patients, they will eventually come down with diabetes. But the sad thing is that 80% of diabetes will become hypertensive. The studies are there, the records are there. So that's why if the patient is hypertensive, it's also a risk factor. But one of the biggest risk factors for diabetes is obesity. Because that's why you see that you have more diabetic cases in the urban center than in the rural center, because that's where you have more form of diets, talking about the urban center. But before we go on in this discussion, EJ, it's good to mention that globally, over 422 million people are affected with diabetes. When in these 422 million people, the low-income countries are more in this number, because right there in Europe and America and some Asian countries, they've been able to marry their diabetes with a lot of lifestyle. So we're going to talk about that when we're discussing treatment. But in Nigeria, over 7.3% of the population is diabetic. But the rural population is less than 3.1%. Again, that explains the form of diet and lifestyle. Now, today we're looking at over 5 million deaths in coronavirus. That is because it's a pandemic. 251 million people have been affected with out of the over 7 billion people in the world. And diabetes is an illness that if you don't have a good glycemic control, blood sugar control, talking about COVID-19 virus, for instance, or even talking about the COVID-19 infection, for instance, if a patient is having diabetes and the sugar is not well controlled, that's just what is your flip side. If you are not controlling your sugar very well, for instance, and the person is affected with illness like COVID-19, the patient situation can get worsened. Again, talking about vaccination. When a patient is having illness like diabetes and the sugar is not well controlled, it's not a candidate for vaccination. Just like a patient that is having some of these vascular diseases, but that's a little we'll come to order. But the most important is that diabetes has some constant features, especially when it comes to increase in urination. But I've seen patients, they didn't have any urinary symptom, they are not even losing weight, or they come with on the clinic, they say, oh doctor, I've not been seeing well, oh doctor, maybe I can't carry out my sexual obligation, maybe talking about erectile dysfunction. Patients on a good day will just come with complications instead of features. And when you run the ancillary investigation, you discover that, oh, this patient is now diabetic, sugar is very high. You now begin to take a history. Does it run in your family? What kind of diet you take and all that? But in all this, it's always good to know that in type 1 diabetes, it's common in children. And even in adults, we've seen it a lot in adults. But the bad thing about type 1 diabetes is that a patient will come in coma. Don't forget there are different kinds of complications we're going to look about. In all this discussion, it's also good to remember that the sugar can be too low, talking about hypoglycemia. You know, when you say diabetes, most times people will just tend to look at it from hyperglycemia, as in high sugar in the blood. But on a very funny day, a patient that is diabetic can come down with low sugar. maybe because of the excess dose of the anti-diabetics we're going to be looking at later. So when you have a patient that comes in to you, one of the routine tests you will do, especially in an emergency situation, is the sugar level. Because a patient can just come in with typhoid fever, come with ulcer crisis, maybe doesn't even know that he was diabetic or the sugar has been high in the system, and you run a random blood sugar and you are seeing 350. So most are in the elderly and the middle age group. So it's always very important to, when you have any features of that's health related, it's always good to turn to the hospital because you can be having an underlying illness. Now, what are the common tests you do to know that the individual is diabetic? First of all, you look at the fasting blood sugar, you look at the random blood sugar. And again, in all this, if you are evaluating a patient that has diabetes, you must do eye evaluation. Because the patient, diabetes and the eye alone is over 10 complications. So that's why you move up to cataract that talk about glaucoma, you go to blindness, there's also called uveitis, scleritis. So these are things that can cause problem to the eye due to the high sugar level. And sugar as it were will affect these nerve supplies, and that's why it's also a very major cause of erectile activity for men. Then more importantly, you will see patients coming with facial swelling. I saw a patient about 3 weeks ago with just facial swelling. Doctor, every morning my face is always swelling. Oh, your mind went to maybe a kidney problem. All to discover this man has been having high sugar level. Even though he admitted that they told him before, he said he rejected it, he went to take herbal medication and all that. That's another risk factor. That if you this is a public discourse, so might not be able to go chronologically. If you are too used to herbal medication, definitely there is a risk factor to develop diabetes, even alcohol as it were, because alcohol most times will affect the liver. And the liver has a direct relationship with the pancreas. So most times the sugar level can be distorted. A patient can come down with diabetes. Of course, infective processes can also be a risk factor to any form of diabetes. Of course, we talked about hereditary and all that. So, but again, the main cause of diabetes, even like hypertension, may not be known. It could be idiopathic, but there could be just some other risk factors. That's why we are saying that once you have any form of complaints in terms of health, it's always going to present to the hospital. So once the patient comes in, so this diabetes, you do your fasting blood sugar if he has not eaten, you do a random blood sugar, you do a urine analysis. There are some baseline investigation you do auto kidney test, liver function, and there's also called this glycemic control monitoring test, talking about HbA1c. It's very important. That is meant for monitoring of those that are diabetic. Of course, you now do other ancillary investigation. For instance, if a patient comes with diabetes, you need to know the HIV status because it has to be immunity thing. Of course, you look at the level of food, the level of blood in the system, look at the blood chemistry, and all of that. Of course, if the patient is hypertensive, you have to send for chest X-ray. If he's having hypertension, you have to send for echo and ECG. So it's actually a disease, one of the fastest killing disease in the world. In fact, globally, it's responsible for over 1.5 million deaths. So it's not an illness that's why I see the WHO have to decide. I've seen families that lost 3-4 persons to diabetes. Up to things like leg ulcer that can lead to amputation, poor wound healing. So the complications are more, and that's why the WHO has to set aside a date of November 14th to say, oh, this is World Diabetes Day, which is very, very, we're going to look at position that WHO towards diabetes and its management as it were. But generally speaking, the diabetes is an illness that is never a death sentence. But what is most important is how are you able to follow the illness. It's very, very important. Because number one, you must admit that this is an illness that is not curable. Okay, because the illness is not curable, the good news is that the illness is controllable. Even though some persons have talked about herbal medication for cure or for control, but those ones are not established studies. But once somebody is diabetic, what one must do is to avoid anything that can further reduce immunity, because controlling of the sugar level is very key, because that's what makes the patient to have a healthier living. For instance, somebody that diabetic that is having poor sexual performance, without that sugar being well controlled, no matter the kind of intervention you have in such complaint is not going to work fast. The same thing with a man that has poor vision. If somebody, an individual has poor vision and the sugar is always on the high side, it is almost always difficult for you to have better visual restoration. The same thing with the man that is hypertensive. Once somebody is hypertensive, your sugar level is not well controlled, if the patient is diabetic, then it can affect the individual's healthy living. So in general, diabetes is an illness that has It has been there for over ages, and is an illness that not even a silent killer because it has several complications. And if you go to the kidney section, the dialysis section, you discover that over 60% of those that comes to clinic are diabetic because we have what we call diabetic nephropathy. So it's a very common complication of diabetes. That's why I was saying that once sugar level has come, once the sugar problem, we must try as much as possible to keep it under control.
Okay. Now, the symptoms you made mention of, does this still apply to the younger ones?
Yes.
Like those from the age of 2? Because there was this video I saw of a boy, which will play much later. He said the parents noticed he had diabetes at the age of 1+ going to 2 years. Now, the symptoms you did make mention of, do they apply to all age?
Yes, they apply across all age groups. That some of these symptoms are more in the younger age group than the older group. For instance, in the type 1 disease, the patient might not come with all these constellation of symptoms. The patient can just come in coma. The patient can come in dizziness. Like you talk about the younger age group, those are the less than 5 years or 6 years. Yeah. I tell you, in most cases, when children present like that, you might be thinking maybe it's a urinary tract infection. Whereas maybe one of the parents is diabetic, whereas maybe there's just some immunological system that may have led to the increase in that sugar level, whereas the mother had an increase in sugar level during pregnancy. Those are some of the risk factors. But for the truth of the matter is that if a young person, this is for parents especially, if you have a young boy of about 5 years old or 7 years old saying, "Mommy, I'm weighing too much," you must take it very seriously. So because they will not say, "Oh, go," or even when you see children that are above, besides female children between 5 and 6, 7 to 9 years, female children are between, let's say, the age of 7 or 9 years, that is still bedwetting. And you know there's a risk factor of diabetes. As soon as you establish the fact that this child is not being sexually abused, it is always good to take the child to the hospital to run the relevant investigation. Because at the end of the day, what if in our present patient is already type 1 illness? Type 1 is because the type 1 is the one that actually run more in family than the type 2. So generally, that children can be having or increase in urination. They have seen a child that they brought to me some 2 years ago who was already having visual problem. Go to school, a 9-year-old boy, could not be seen in the board. Only to discover that the child was now also having frequent urination, and at the end of the day, we'll now discover that the child was diabetic, had type 1 disease. So in children, the symptoms can be very vague. The presentation can be very bizarre. But what is most important is that there are some of these cardinal features of diabetes that we know as it were. But for the older age group, most of the time they might come down with frequent urination. But it's always very difficult to distinguish between frequent urination in a man that have BPH and frequent urination in a man that is diabetic. And the both illness can be in existence in an individual. So generally, the most important way to make diagnosis of diabetes is to present yourself to the hospital or any of the health facilities so that the patient will be thoroughly, the individual will thoroughly be evaluated. And like I said earlier, once somebody is diabetic, it's not a death sentence. It's a controllable illness.
All right, so the theme of this year's World Diabetes Day is access to diabetes center, in particular medications, technology, care, support, nutrition, and exercise. So do we see this care taking place in Nigeria? Yes,
this care has been there from Adam. I will tell you. First of all, one of the easiest way to manage diabetes is diet. So you start from dietetic approach. And when you're talking about dietetic approach, there's what we call lifestyle modification, lifestyle medicine, where diet is key. But in diabetics, diet is very indispensable in management of that patient. We know the kind of foods you're going to eat.
So a diabetic person cannot eat every kind of food?
A diabetic person will only eat some specific kind of food. That's why a patient will have longevity. Because, for instance, you're not supposed to be involved in all this fatty diet. You're not supposed to be taking things like alcohol.
So can a diabetic patient take carbohydrate foods?
No, the carbohydrate is specific. For instance, if the diabetic patient is having adequate weight and having good sugar control, the diabetic can consume up to 12 to 14 spoons of rice alongside vegetable, for instance. So, but those things must be guided through the dietitian, the public health nurse, and the physician. So you cannot just jump into some of these diabetes. For instance, the diabetic patient should do well with these unripe plantains, Some person talk about special kind of wheat bread, and of course you have things like cocoa yam, water yam. Time will not allow us to go into all that. But the most important thing is that the diabetic, there's no like diabetic diet. It's just like there's diabetic advice. So you must know the routine, you must know the kind of cost that you must consume in terms of a diabetic patient. But that's just one. Then the number two thing is smoking. A diabetic is not expected to be smoking. If you were smoking before, you should stop smoking. In fact, when we're talking about risk factors for most illnesses, smoking is one of the major risk factors, also for diabetes. So smoking must be avoided. Alcohol must be avoided if a patient is diabetic, because it will affect the sugar control, okay? Then, of course, exercises. When we're talking about exercise, you are looking at compatible exercise. We are looking at this combination, the combination of things that the WHO has profiled. So exercise must be compatible and must be safe. We had a case of where some persons were doing exercises and they were knocked off on the road. So you must do exercise in a safe environment. It must be compatible, whether it's brisk walking, minimum at least 3 to 4 times a week within a period of 30 minutes. You cannot expect my grandmother, who was diabetic and died in 2008, to be running around the field in my house or running around the field. So maybe talk a brisk walk, or maybe try to, in fact, most times elderly people, you tell them to take brisk walking. Brisk walking is moving for within 30 minutes. But look at things like sleep hygiene. Somebody must adequately, an individual, an adult must have adequate sleep. Okay, talking about between 6 to 8 hours every night. So this is then adequate intake of water. So those are things that you need to look at in that lifestyle. Then when it comes to medication, I just mentioned in my introduction that insulin was discovered far away in 1921. That was about 100 years ago. But to date, insulin management is almost always, the endocrinologist will tell you, oh, we can use insulin, but the oral hypoglycemic agents, the common drugs that you know, are very effective to date. But these things will not be done alone. You must do it alongside your physician. You must do it alongside your clinician and your public health nurses, because you cannot just be taking all these drugs without doing a follow-up. There must be a follow-up. So those are some of the things that WHO Charter has talked about, that there will be drug approach, there will be diet approach, there will be other form of lifestyle approach to any form of illness, including diabetes. Of course, there should be follow-up. Most importantly, EJ, you must notice when you begin to have complications of this illness. Because one thing about, we're talking about secondary prevention now. The primary prevention is that, oh, my grandmother was diabetic, my mom did everything not to run into this illness. I'm still struggling on my own side because my grandma was diabetic. So I want to see how I can be able to do all my lifestyle not to run the risk. That's primary prevention. Secondary prevention is that the illness has come. How do you now go into preventing complications? That's the most important about diabetes. Because there's a common saying that said that if you control diabetes remains a poor man's illness. But if you allow it to get complicated, it becomes a richer man's illness. What that means is that, just take an example of a man that has high blood sugar and was not controlling that sugar level and now have kidney problem. You and I know how much is a short of dialysis. You and I know that one of the ways to go out of that kidney problem might be a kidney transplant that goes up between 10 and 15 million. That's what the far side. What of a man who is comfortable financially, run a home, maybe run a polygamous home, and is diabetic, and is not taking his drug regularly, is not seeing his physician regularly, not doing his test regularly, and now have erectile dysfunction? You know that erectile dysfunction is going to lead to family dysfunction. I'm a consultant family physician, so I know the problem these things can lead to. So that's what we're saying. Let's leave all those one. What about vision? If a man is diabetic and you're not controlling your sugar very well, so you can come down with things like glaucoma. And one of the commonest causes of glaucoma is not just aging. We have seen people as young as 27, 30, 32 having glaucoma. But what we're saying that we're not saying that diabetes, the patient must have glaucoma. No. If the sugar levels are not well controlled, these are some of the possible complications. A lot of persons that are glaucomatous, they don't have diabetes. But one thing about illness is that you don't go it alone. You must always say you need to go to the health facility. That's why we are missing it in this part of the world. And we're just lucky that coronavirus, because of our pigmentation or environment, it didn't hit us hard like we hit the diaspora. More people died this year in America than last year. Not necessarily because of the COVID-19, but we're in a pandemic era. But for this kind of, we call them non-communicable diseases. They are not like hypertension, like obesity, like arthritis. They are not curable, even like peptic ulcer disease. But you can control them. So on a general note, WHO has said the whole ball is on our courts. These are the rules of the game. And these rules, you can't do them alone. You must work with your physician, you must work with your social worker, you must obey by the rules of the game. You see persons that are even diabetic taking very dry gin. And you know the risk factor. You see persons that are diabetic are not taking their drugs. You see even persons that are diabetic, they are skipping meals. When you know that you're supposed to take your medication in the morning, 30 minutes before me. And now you're always skipping me, maybe due to fasting, or maybe due to social life and all that. That will further weaken the liver, because once the pancreas is not active, the liver, once the sugar is not well, it weakens the liver and also weakens the kidney. So we once know that some of these illness can affect the organs, we must see the need to rise up to our own occasion, to do our own part of it. Like the WHO Charter has proclaimed that diabetes, most of these illnesses are for us to be aware of, and government too has a big role to play. Like the media houses doing their role now, sensitizing the public on how to go about every kind of illness. But diabetes is not something we can flog, because it's not a silent killer. It's a very common killer of individual, but it is also a very controllable disease. Millions of Nigerians are affected with this ailment, but I tell you, a lot of persons also deal with this ailment because it's a controllable disease.
All right, we're talking about diabetes today on FLIPSIDE. We'll be right back with Dr. Ojo Barry. Don't go nowhere. All right, if you just joined us, this is FLIPSIDE with Oloije Oikohai. Now we're talking about diabetes. On Sunday will be World Diabetes Day, and we did tell you about the theme, access to diabetes care. Now we're looking at a short video done by a young boy, letting you know how he is coping and surviving as a diabetic patient. Don't go nowhere.
Hi, I am Vath. I'm 13 years old and I've had diabetes since I was 2. Every morning when I wake up, I check my glucose levels and use my BDDC app to keep me on track. I grab a new needle and find the right spot. My routine never changes. Living with diabetes can feel like carrying a backpack 24/7. But today, I'm excited. I am taking my backpack on a mission. Even when it's dark, I am not afraid. Trying new things that others tell me are too tough. I have my highs and lows, and not just my glucose levels, but also how I feel. Sometimes, I wish I could just throw my backpack away, but people like us, we're born to be brave. My life is full of surprises. Also the ones I did not plan for. But I keep going. And when I think that everything is under control, another surprise hits me. Unlike other kids, I need to inject my insulin. But you know what? That's okay. Because I know I am not alone. For everyone living with diabetes, there are lots of peaks to be climbed. Through good and bad weather, we never quit. Type 1 or Type 2, we all have our own backpacks to carry. But together, we can reach the top. No one climbs alone. We climb together.
All right, we have seen it that it doesn't just only affect the elderly, but also the younger generation. Dr. Barry, I would like to ask you now, diabetes, does it cause other ailments?
Yes, just that we're talking about complications or maybe responsible for other illnesses. One of the commonest complications of diabetes is hypertension. So most persons who are diabetic, over 80%, almost in their lifetime become hypertensive. That's number one. And number two, a lot of patients that are diabetic will now come down with things like kidney diseases, either acute renal failure or acute kidney disease or chronic kidney disease, okay? Then of course it can lead to things like glaucoma. And diabetes has also caused problems with like erectile dysfunction, and even very commonly, urinary tract infection. A patient that is diabetic most times have a higher risk of having a urinary tract infection. Of course, because it leads to poor wound healing, the patient tends to run the risk of amputation. So generally, diabetes is a multi-systemic disease. It can affect the heart. It can cause all these coronary heart diseases by way of causing some problem that can make that also lead to heart failure. Of course, a diabetic patient is going to have a lot of immunosuppression. So definitely the individual as diabetic, if the sugar is not well controlled, can also come with low immune status. But generally, once a diabetic status is well controlled, very many times, most of the time, patients will not come down with some other comorbidities, as we call them. But what is most important is that just know that apart from insulin that we're seeing on that young boy, also know that it is most times lately, we only use more of insulin when a patient has not been able to have blood sugar control when it comes to other oral hypoglycemic agents. There are so many in the market. Okay, so we don't need to be bothered to mention them. But what is most important here is that it's only when in emergency situation, there's what we call diabetic ketoacidosis, where a patient has high sugar and it comes down with coma. And you have having what we call acidotic breath. So many times you must bring in the short-acting. There are different types of insulin, long-acting, short-acting, and soluble insulin, so, or even the intermediate. So you must bring in insulin therapy for the patient to get back, because what insulin does is to reactivate the cells that are responsible for the control of sugar, which is called the isolate or Legarans. So insulin, of course, is the oldest medication that was used to treat diabetes. But there are several drugs lately that one can go with alongside diet that can be able to control diabetes. But again, in type 2 diabetes, patient can come with what we call hyperosmolar non-ketogenic syndrome. But in all these ones we're talking about now, patient can also come down with hypoglycemia. And hypoglycemia value is any sugar level that is less than 40 milligrams per DL. And in this case, patient will be in comatose state, patient can become restless, patient will have a pounding heart, patient could always die. So in that case, you don't have to bring in glucose. And that's when we are giving medication to the diabetic patient. You tell the patient, you explain the symptoms of hypoglycemia to the patient. Maybe you see your heart is beating very fast, your mouth is getting dry, your eyes are turning you. Just know most times that you might be having low sugar. Okay. So you now tell the patient, really take soluble sugar like sugar itself, can take a Coke and all that. But in the hospital, when the patient is hypoglycemic, we'll bring in 10% dextrose or 50% dextrose by way of intervention in the emergency care. But generally, diabetes and the eye alone is over 10 complications. So it is not an illness that you can weigh by the side. But the problem we have in this part of our environment is that people take health matters in a way that, oh, is it not this, is it not where I used to this, my grandmother was this, my father was this. But you know that one individual illness might differ, because our body immunity system differs. And diabetes is one illness that chop off the immune system of the individual. So that's why you must do everything possible to be able to maintain the sugar level. And the sugar level at every given time must be less than 100 or less than 105 as it were. Especially when somebody has not eaten any food. And that's why we also talking to traditional institutions, religious institutions to please, let's not mix orthodox medicine with unorthodox. This is one of the illness where you might not have to mix those things, because at the end of the day, I know there's spirituality in medicine. I'm a family physician. I believe in herbal medication. I believe in alternative medicine, but we should not allow it to overrule what the orthodox approach is, as it were. Because with this, a diabetic patient can now have a graceful aging Of course, healthier living and have graceful aging. And if you have all this, that you have longevity. For instance, AJ, if a man is diabetic and the man is HIV positive, or the man is an HIV patient, and this sugar level is not well controlled, and the man's viral low, maybe the man is not on anti-HIV drugs, and they go and take things like coronavirus vaccine, the patient will calm down. These are some of the things the public should be aware of. It is always very important for you to know your health status. Or your mother is having hepatitis B, for instance, and it's a carrier, it's a chronic carrier, it's not on any form of medication, then you go and become diabetic. These are two deadly illnesses. So that's why it's always good, once somebody is aware of any form of chronic illness, put it under control.
Okay.
Call it any form of illness, so that one can have a healthier living.
Okay, now, is it, like you mentioned, two types of
Yes, in
diabetes
type 1, primarily in type 1, we use more of insulin to manage it, just like you said, that young man, that young boy, that teenager. In type 1 diabetes, because of the nature of the illness, because it affects more the younger generation, the younger population.
Affects the younger population.
So you and I know that it will be easier for us to put that child on insulin, because they might not be compliant with drugs because of their nature. 2, type 1 diabetes is intractable. It's more life-threatening. So it's not something that you say, oh, medication. Then 3, it is easier to have better glycemic control with insulin than the oral hypoglycemic agents.
So what about the type 2?
Type 2, it now depends on the presentation of the patient. Depends on the stage of the patient. If a patient is having chronic kidney disease, you and I know that the liver is already being affected also. So it is definitely, you must add insulin therapy. That's why we're talking about combination therapy. So you can have insulin, drug, and diet. You can have insulin, diet alone. You can have insulin alone alongside diet. Then we can have the 3. So you can, patient can be on insulin. Patient can be on another form of drug like glucophage. Patient can be on another form of drug like amari. So like a combination therapy. Because even in the oral hypoglycemic agent, there are different categories. You know, you have the sulfonylureas, you have the big ones, you have the glucosome. There are different categories of those ones. So you can also now combine them. You know, so, but again, it depends on the attending physician. I know it depends on the patient's comorbidity. For instance, if a patient is diabetic and is hypertensive, you must put a patient on a particular kind of antihypertensive drug called the angiotensin converting enzyme inhibitors, which people commonly consume, like lisinopril, ramipri. They are umbrella drugs, they are not individual drugs. So that drug will not just only remodel the heart for the individual that is hypertensive. That drug will not just only control the sugar level to blood pressure level. It will also protect the kidney. And once a patient is diabetic and is taking and is diabetic and hypertensive and is taking an antihypertensive drug that has renal protection, protecting the kidney, there's a plus for the management, and that will give a better health outcome. So that's what we're talking about, rational use of drug. That's why it's compulsory for individual to present themselves in the hospital. The hospital
get their health history.
I know it's difficult to go to the hospital, but you have someone has no choice. I drove all the way from Cameroon to come to this place. So what do you take for if I have need for doctor to be choose any of the private hospital? So that's what we're seeing in this kind of flip side, because it's very key. And that is why you see Europe and America and some other developed countries, they are having better healthcare because of the level of awareness and level of compliance. You see me and this one here, when people are still calling in to say there's no coronavirus, because the self-denial is a problem. One problem by HIV status is that a lot of people have to take the HIV drug, but you know that if they don't take it, they will die. But you have seen some other illnesses that say, no, that's not happening here and there. So what we're saying is that if you take your sugar drugs by way of layman language, and you obey the rules of the illness, from lifestyle to diet to whatever form, definitely the sugar level will be controlled. No matter how, but I tell you that the type 1 illness is more difficult. So that's why we put it more on insulin than the type 2. So those are type 2. Don't forget there's also pregnancy induced. Pregnancy induced diabetes, we call gestation and diabetes. So in those cases, it is just compulsory that the patient has to be on insulin. There is no way you can bring in oral hypoglycemia, because most of those agents are contraindicated in pregnancy. Then in the maturity of the same thing, you have to bring in. But it was there. So it depends on the individual patient, and it depends on the attending physician, and it depends on the investigations and all other features that are being carried out on the patient. But monitoring of the sugar level is very key. Like the glycolated hemoglobin that we'll talk about, HB1AC. That one normal level is anything that is less than 6%. So one is greater than 6%, which is not well controlled. So you must, or that one is done every quarterly. So if you don't go to the hospital, you will not know. But then, of course, go to support groups. Join the support groups of diabetics. That's what we talk about. That's what we do for HIV, AIDS, cancer, and other groups. Just join the people that are diabetic, follow them up. Of course, there will be social workers. So
create a family.
Yeah, so that at the end of the day, you will not see it as a way of life. But the problem we have in this environment is that they see illness as a stigma. The patient came to my private hospital about 2 weeks ago. The man was diabetic. And I was saying, oh God, why is your sugar like this? He said, Doctor, no, don't carry me come home. My wife is very angry. I can't carry out my surgery. I said, you see the problem? This is what is responsible. But before this ago, the man is happier. What I'm trying to say is that some of these illnesses that we're even scared about is already causing some complications that you were talking about, other illnesses that can cause more problem. Diabetes, one of the complications of diabetes is depression. Because at the time somebody is not able to carry out somebody's obligation, the individual can become depressed. So that's why this kind of FLIPSIDE program is very key. Because you must take your health, because people have said that health is wealth. We agree. But how much are you pursuing the wealth? You must follow your health. So it's very important that the diabetes is a story that cannot finish in 100 years. But we must accept an illness and follow it as such.
Okay, now can exercise help to reduce
That's what I'm
diabetes?
saying. Exercise is like the WHO has programmed.
In which of this? Is it like type 1 or
in
type
both
2?
of them.
In any of them?
Even in gestational. A woman that is not having pregnancy, just diabetes, and there's some side that will be prefer to pregnancy. So it's very key, because what exercises does for the body is to create a lot of catabolic activities for the body, and it breaks down a lot of fats, as it were. So exercises are key, but it must be compatible, and it must be prescribed by your attending clinician or even the public health nurse. It's very, very important. Exercise is key in all the illnesses. Okay,
now we want to look at how we can manage.
Okay, management of every illness has to do with, first of all, you accept that there is a problem. You want to be part of it. You want to get solution to a problem. And illness is one thing that once it comes, it is not always a death sentence. It depends on the way we go about it. So we look at management from the level of the kind of, yes, then we are looking at the kind of treatment. We are looking at the kind of the test that we'll be doing for that patient from time to time, like in this diabetes of a thing. Every month or every 2 weeks, you are expected to do your sugar test. I agree that some people can have their glucometer at home and be doing their sugar test and all that. But it's always good to carry your physician along and your public health nurse along. That's number one. Then two, the drugs. You must comply with the drugs. Drugs are numerous in the market. Again, don't forget that some of these drugs can make the sugar to become too low. So you must not take your medication alone. You must get back to your doctor. You must be involved in follow-up. You must be involved in the right diet. You must be involved in regular exercises. There must be adequate water intake. You must stop smoking. You must, of course, avoid alcohol. So in all this, your behavioral attitude towards the illness is very, very key. So management of diabetes is one, diet. Two, the other parts of lifestyle modification, like we talk about exercise and all that. Three, your medication. Your medication is very, very key. I sympathize with a lot of people who are using insulin for the adult. It's not always easy, because you're going to be pricking yourself virtually every day. That's why in family practice, where I specialize, we'll try and take the patient out, especially for type 2. We struggle to take patient almost always out of insulin therapy. Part of the fact that it's very expensive, part of the fact that it's very, very uncomfortable. Of course, it can be very dehumanizing. You get to see some diabetic patients, you get to look at their legs and their muscle, a lot of spots and all that. So we try as much as possible to make sure that patient takes the best medication to be able to have control, because it is a controllable disease. It is not a curable illness. Because I know that a lot of public persons are thinking that, you can cure. You see a lot of spiritual you tell you I can cure this, I can cure that. These are some of the illnesses that are not curable, but they are controllable. Once it's controllable, patient is most likely to have a healthier living, and there will be longevity.
Okay, now do we have a special unit that takes care of
Yes, of course. We have special unit that takes care of diabetes. For instance, in family medicine, there is this unit of lifestyle medicine that's in charge of this non-communicable disease that they call diabetes. Of course, in internal medicine, you have the endocrinologists, those who are in charge of all forms of diseases, not just only diabetes. They can be also in charge of things like thyroid diseases and all that. So endocrinologists are the ones that are especially made to take care of diabetics. But for we family practice, we have our unit that also takes care of diabetes situation. But like we said earlier, diabetic clinics are everywhere. In most of the government hospitals, you have their diabetic clinics. But with those of us that are specialist generalists, sugar control is as easy as ABC. But we need the patient's compliance, because every management of any illness has to be patient-centered. But that's why you must bring the patient to your level. You'll be at common ground with the patient. They will know what and what will do for the patient, but at least you do a follow-up.
Okay. Now, as a doctor now, is there an awareness that are being created, like this day being set aside by the United Nations concerning World Diabetes Day? Now, apart from the United Nations international body, is there a body set aside as far as Nigeria is concerned?
There are several bodies that are in charge of diabetic situation. There are a lot of bodies that I know. There are a lot of them. Time my man permit me to mention them. But what is more important in this public is that in the Nigeria situation, people tend to pursue shadows. Like, look at this kind of program. This is the kind of program that you see in Ghana and other areas. Okay. Something that is very important to an individual self. So it is not government that will do everything. I expect some non-governmental organizations to come up from time to time to make create public discourse on all this, so that people will become more aware of this situation. But I tell you, these days, it looks as if the generation where we are coming from marry more of health matters than this present generation. And it's very unfortunate. So what we're saying is that programs can be conducted from time to time, not necessarily government, because government is just too busy. No governmental organization, individuals to begin to profile, to begin to campaign about the reality of these illnesses, not just only diabetes. Okay, for instance, we have a pandemic now. The whole thing has gone down. A lot of people are no longer wearing face masks. A lot of people are no longer obeying social distancing. But this thing is still operable in the diaspora. But we should see the need to do door-to-door campaign about every illness. But if somebody is diabetic, is not having glaucoma, is depressed, he doesn't want to hear about the illness again. Whereas the next person can also be diabetic, and maybe his son can be diabetic. So what we're saying is that we're appealing to the public that some of these illnesses, one of the easiest way to go about it is to do your regular hospital check. Because it's a third world country. I tell you now, some people say, no, I can't do busybody, I can't have the time, struggle to make it.
I can't stay on the long
I want
queue.
to make it, I want to make it, I'm not interested, whatever it is. But this kind of program is key, very essential. Where our listeners and viewers at home, we are trying to appeal to all of them and pass our message across that diabetes is real, diabetes is controllable, diabetes is not a death sentence, and of course it can be with it, someone can live his or her normal life.
All right. If you just joined us, we have been talking about diabetes. Now, a quick one to let you know the theme again for this year's World Diabetics Day is access to diabetic center. In particular, medication, technology, care, support, nutrition, and exercise. Now, Dr. Barry Ojo has talked about nutrition. Now, before we go, please, Dr. Ojo, I would want you again to tell us what particular food we should abstain from. Because some persons, they actually don't know the particular food they should abstain from.
Okay, AJ, let's look at it. Time is now our friend, but basically the kind of, for instance, a patient that is diabetic has no business with red meats. Because red meat carry a lot of cholesterol. Let's look at the protein aspect now. Patient that is diabetic should do more fish, and even the fish has nothing to do with those riverine fish, things that don't normally dry fish and whatever. Then let's look at things like bread, for instance. Bread is easily consumed by most population. You should go with there's a special wheat bread that is meant for diabetics. Then with the biscuits, you can stay with crackers because there's some iota of sugar in the biscuits. Then for carbohydrates generally, things like water yam, things like cocoa yam, of course unripe plantains, These are some of the things that diabetics should stay with. Okay, then of course things like rice. The diabetic patient can consume rice, but before you do that, you must be sure that your sugar level is under control.
Okay, thank you. So, and what?
And of course, generally, drinks and all those alcoholic drinks and sugar drinks should be avoided.
Abstain from them. All right, thank you so much, Dr. Barry Ojo, Dr. Ojo Barry. All right, he is a family physician. He has done well to, teach us more about diabetes, World Diabetes Day, which will be on Sunday. Yes, and our focus is letting everyone out there know that they need to go for medical check every other time. Now, it can be monthly. You can just set a day aside. Say, this day of the month, I will be going to the hospital to go do my routine check. All right, so if you want to be in touch with Dr. Barry, all you need to do is put a call across to him. He will be letting you in on more details as far as diabetics and every other thing. Family physician, he is a family physician, it's all about. Now on 080-2668-7187, 080-2668-7184. Now 8787. All right, so we'll be seeing you again next week for another exciting time on Flipside. Do have yourself a blessed day and a healthy one at that. Bye for now.